In a previous Give Me 5, we touched on the whole idea of chest tubes with trocars, meaning javelins, versus the far more humane baby to big people use of pigtails. However, in this one, I want to just quickly touch on two things when it comes to taking care of patients with chest tubes. The first of which is, remember that as we look here, we've got our actual chest drain. And we follow the tubing down and it comes over to here. And right here, you notice, is where it attaches to our actual chest tube, which is happily taped down into the chest. Great. So with that, what do you do 2 o'clock in the morning? The patient puts on their call light and says, "Hi, do you need this?" And they hand you the chest tube. That's a problem. Do a couple things in reality. Number one, most importantly, do not try to put it back in. They don't pay you or I enough. Number two, what do you do is called cover it up. Because now you have a hole and air and blood is going to be escaping in and out. So beyond that, remember what we're taught in school is that we put some variation of Vaseline gauze. And the idea being that Vaseline gauze is not going to allow air to go ahead and go in and out. But what's kind of neat is some of y'all remember up until recently, especially up in the big people ICU, the way that you know you had a patient with a chest tube is twofold. First of which was called you looked at the wall. Because in every ICU patient room that had a chest tube, ICU nurses would tape Vaseline gauze to the wall, to the cupboard, to the window. Somewhere at eye level so that way we knew where the Vaseline gauze was. Which is great, except remember patients go on road trips. And if your patient is now down in CAT scan and they rip out their chest tube, where's the Vaseline gauze? It's called tape to the window. So what works far better is a really neat trick, and that's called don't tape it to the window, tape it to the chest drain. Because think about it, anywhere your patient goes, their chest tube and the drain hopefully go as well. And it's just a really nice way to make sure if it decides to fall out, you always know where your Vaseline gauze is. Now the other issue is if the chest tube happily is still in the chest. But remember, we also have right here. So when the chest tube first goes in, remember this sits in the chest, this is all attached to the drain. And this gets placed into here, and we normally tape the heck out of it. But what about if it's still in the patient's chest, but you walk in the room and you find the tubing laying on the floor? What do? Number one, freak out. Number two, after you're done freaking out, the way you know you had a patient in the ICU with a chest tube, remember, is twofold. Number one, you looked at the wall of the window. Number two, you looked at the nurse. Because ICU nurses were famous for 12 hours wearing scrubs and a Wild West holster. And on either side, they had chest tube clamps. And we walked around for 12 hours just waiting for somebody to become disconnected so I could clamp them. And we wanted to clamp them so bad I couldn't stand it, but they don't recommend you clamp. The rationale is, number one, you put this thing in for a reason, that's a lot of stuff to come out. Number two, studies in open heart have shown that people who clamp when things calm down tend to forget to later unclamp. So what you do if you walk in and it's on the floor in reality is a couple options. Number one, if you happen to have a sterile bottle of saline water, something of that sort, and you can go ahead and put this into the bottle so that way water cannot get sucked back in, but air can come out. Great. Option number two is called take this, wipe it off with an alcohol pad or some Cavicide, and put it back together. Then you go down the hall, get a new chest drain, come on in, and hook it back up. It's not the ideal. The ideal is it didn't come apart in the first place. It did. Get over it. So if it becomes disconnected into sterile saline, wonderful, or a little bit of Cavicide, wipe it off and do what you need to do.